Hi, ladies, and welcome to this episode of Ask Dr. Susan Live. And I get so many questions about hormone replacement. So we're going to talk to two callers today who have questions about the estrogen patch, because those are super common questions, and I'm sure you'll all want to know about them. And if you have a question for me about anything to do with midlife wellness, whether it's menopause, perimenopause, hormone replacement, sexual wellness, or any of those things, you can submit your question to drsusan.com/ask. That's drsusan/ask, and we'll try to get to as many of those questions as possible. So our first caller today is Mary Beth. Hi, Mary Beth.
Hello, Dr. Susan. My question is, what is the dosage you recommend? What is the dosage you recommend for the transdermal estradiol patch?
And that is such a common question. And I will have to tell you that I actually used the estradiol patch myself for several years, and it's a great way to get estrogen in your system. As we've talked about here before, lots of times, we don't want to take estrogen by mouth preferentially because there's a very small chance that it can upset the liver and increase blood clotting factors that can even lead to blood clots the kind that happen in your leg and then can even travel to your heart and lungs. So the estradiol patch is a great way to get estradiol into your system. I'm so glad that you're taking it. But your question about the optimum dose is really a great question, because our skin, as we all know, is a barrier to things getting into our system, and it does a great job of preventing things from getting into our system. So absorption is very variable, to say the least. So on a certain dose of the patch or a cream, for example, different patients are going to get different blood levels of estradiol in their system. So patches come in different doses. There's certain ones that are made. Which one are you on?
I am on, it's 0.025 milligram.
Okay, and that's a really low dose. So just for other listeners, the estradiol patch comes in several different doses. The lowest would be the 0.25 milligrams that you're on. It also comes in a 0.375, a 0.05, a 0.75, and a 1.0. So as you can see, there's quite a few different choices. Do you mind if I ask how old you are?
I am 59, and I just started the estradiol patch about a month ago. I went through menopause at age 47, and I've just, I've been searching, and not until recently did I really find the information I needed to really educate me on what would be helpful to me. I'm very healthy, so the doctor was open to starting the estradiol patch with the idea that it would help me with the prevention of osteoporosis.
Great.
But it was also said during the exam that the belief was that it probably would not help me, like for heart attacks, prevention of heart attacks. So I wasn't sure I was necessarily on board with that, but yet I did want to start it because of everything that I've learned from your podcast as well as some other podcasts that I've been listening to. So, and what I've learned is that possibly the minimal necessary dosage to prevent heart attack, osteoporosis, and Alzheimer's would be like 0.5 milligrams. And
so many good parts to your question. Oh my goodness. I'm so excited that you're asking all of this. So just to review a few things that I heard, you actually had been in menopause and probably had no estradiol in your system for a little bit more than 10 years, right?
Yes, that's correct.
And then I'm so glad that your doctor put you on estrogen, because a lot of physicians still refuse to prescribe estradiol to a patient who's been postmenopausal for more than 10 years, which is really sad because that's providing so many benefits. And we talked about this in a podcast a couple of episodes ago, also on the YouTube channel, where Michelle, my executive assistant, and I answered lots of questions about menopause, and we talked about this 10-year estrogen window. You can also refer to one of the videos a few weeks back about why estrogen matters, because this idea of the 10-year estrogen window is really important, and there is some truth in it. So what they told you about how when you've been postmenopausal for more than 10 years, you may not reap some of the benefits that you would have if you had been lucky enough to have the opportunity to start it earlier. That's true, but I always say it's kind of like putting money in the bank. Just because you didn't start saving when you were 20 doesn't mean it's good to start now, whenever that is. Now, if you were 300 pounds and you smoked cigarettes and had high blood pressure and already had heart disease, it's true that there may be a slightly increased risk of causing a heart attack for those patients when they start on estrogen. But what I'm hearing is that's not you. You're very healthy.
Correct. Yes, I'm very healthy.
Right.
Did everything before my visit. I went to the cardiologist.
Perfect.
Had a bone density scan, so yes.
Yeah, so that's exactly what I suggest for my patients to do when they've been postmenopausal more than 10 years, is just make sure that they have a healthy heart, and then we can start on estrogen and still reap the benefits for osteoporosis reduction, heart health. You'll still get some benefits. You're young. So I've used vaginal estrogen myself, and it does work, but it's sticky, it's messy, it falls out, the opportunity to have sex comes up, and then it's like, oh no. So what I do now myself is I'm on a dose of estrogen that treats vaginal dryness and all of the other symptoms. And it sounds like you're probably not on a high enough dose of the patch in order to treat all of those things, not to mention the long-term health benefits we already talked about. So the way that I manage that with my patients is by drawing your blood. And is that something your doctor's ever offered you?
No, and that's interesting that you're saying that. So I'd like to know more about that. Like, what would I ask for when I'm asking for my blood to be drawn?
Yeah, so it's definitely controversial amongst physicians whether blood levels are helpful, but I've found them to be incredibly helpful. Numbers that I look for in my practice are for your estradiol to be somewhere between about 40 to 80. And that coincides with symptom relief. So it coincides with when vaginal dryness gets better. And it also coincides with when the benefit for our bones, our heart, our brain occur. So if your estradiol level was, say, 25, I'll just make up a number, I would suggest to you that that's not enough. And you may also be experiencing that it's like, hey, I'm using this patch and my vaginal dryness still isn't improved. So at 40 to 80, that's still a very low level. So just keeping those numbers in mind. When we were young and fertile, our estradiol levels ranged from maybe 100 at the lowest during our cycle to even as high as 500 when we're ovulating. So just putting that in perspective, 40 to 80 is still a low level, but it's enough to get rid of all of our symptoms. So my guess is on that 0.025 patch, your level's probably, in my experience for my own patients, too low. So commonly we'll start on the 0.05 patch, not because that's right for everybody, because people do absorb things differently. I have patients on the 0.05 that are too low, and we go up even higher. But I found it very unusual that the 0.025, the teeny tiny baby dose, is enough.
So so I could go to like an outside lab. That would probably be the easiest for me, and then go ahead and get those blood levels drawn. And then if I do see that it's below, which more than likely it is,
might be,
I could then present it to my gynecologist with the hopes that there'll be an understanding that, oh, okay, that probably is too low.
Yeah, so you could do several things. So somewhere or other, I would ask a lab to check your estradiol level. Now, your doctor may be open to do that, or many cities like in Houston, or where are you calling from, by the way, in the world?
Chicagoland.
So Chicago, big city. So I'm positive in Chicago there are Easy Lab, or you can get, like in Houston, it's called AnyLab.com or something like that, where you could sort of show up and order an estradiol level and see what it is, just for your own curiosity. Now, it's possible that your doctor might see that and be like, we don't believe in that. We don't believe in hormone levels, because we're all trained differently. And I'm not criticizing anybody else's management, because frankly, I used to tell patients not to get their blood levels drawn. I used to tell patients just go on the lowest dose that reduces your symptoms. But one thing I'm pretty certain is that 0.025 is not going to get rid of vaginal dryness. And that's a symptom, so that counts.
Yes, and that's interesting that you said that, because I really didn't realize that. I thought only estradiol cream would help with the vaginal dryness. I didn't realize that actually the patch. Taking the patch would help with that.
So when you use a patch or a pellet or a pill, for those of us who are still taking it orally, and that's not my first choice, but certainly some people still take estradiol by mouth. We're getting estrogen head to toe. So your scalp's getting some, your hair follicles, your skin, your fingernails, all the way down to your toes, and some of it's going to the vagina. Now, it's true that you may need more in the vagina than is delivered in the patch, but if you're on the ideal amount of estrogen, you won't need to use the cream. So
that's wonderful.
I'm fingers crossed
wonderful.
that if you were on the right dose of estrogen, you could eventually get rid of that cream. Now, it's not the wrong thing to do to use the cream because we really want to get rid of dryness. But
sure,
the goal long term is once the dryness has resolved, that you don't need to use it anymore because you're getting it in your whole system, and that's going to keep it maintained. And that's an awful symptom. We really want that to go away.
Yes, I agree. I've suffered from that for many years. And that kind of prompted my desire to learn more, to say, what else can I be doing for myself? So that's very interesting.
I'm so glad that you're asking these questions and advocating for yourself. So I think the most important thing that I've learned, and I learned this just in the past few years, is that patches, creams, even pellets, we can put the same dose in 10 patients and we're going to see 10 different blood levels because people absorb things differently, particularly across the skin, because the skin is designed to be a barrier. For example, when I was using the patch, I was swimming a lot and sometimes it would fall off, or I like to take baths and some people shower. Temperature is different in Chicago versus Houston. There's a lot of different factors that affect absorption. So it's just incorrect to think as physicians that what's on the box of the patch is what you're going to get in your system. There's so many variabilities, but if we draw your blood, we can see what you're actually getting. And that's why I've really started to rely on blood tests more than the dose on the box, if that makes sense. Because you might be absorbing lots more than the average person or much less. We really just don't know what your body's actually getting.
Okay, and I mean, are you saying though that if I'm still trying to wrap my head around this. So if I would say that, my blood level, my estradiol level is say 25, mm-hmm. I could present this then to my gynecologist and say, it seems that I'm still low based on what appears to.
Yes, and that would be too low. Now, okay. Depending on your sense of your gynecologist's comfort level with this discussion, you might just tell them you're still symptomatic. Can we go up on the dose? So keep in mind 0.05 would be the most typical standard dose. So they already know you're on a very low dose. So I wouldn't be surprising to her that you're still symptomatic, I'm sure, because that's a very low dose. So you and I might know that you want to be in the 40 to 80 range.
Right.
Right now, you know more than 99% of gynecologists. So you're going to have to feel people out. But, certainly presenting that you're still symptomatic, which you're telling me you are, would warrant increasing the dose.
Okay. Well, this has been very helpful because that's kind of one of the things I've been trying to search out is what is the minimal dosage, and it's been a journey, because I did go, my first gynecologist and I had gone to her for a long time, was not supportive of going on any kind of hormone therapy.
And that's so sad, isn't it? Because, we're missing out on so many health benefits, not only that, but just feeling well right now and having a healthy sex life and sleeping well and all of those wonderful things.
Yes. So, and then listening to your podcast as well as some other menopause doctors, I realized, wow, there's a lot out there. And, I'm like a sponge. I'm just trying to, get all this information and be my own advocate, really. So.
Well, I'm so glad you called you called about this because that's a really common question. And I'm sure lots of listeners have the same question. Like, wait a minute, I'm getting this dose in the patch, but what's it actually doing for my body? Do I need to be on more or less, or how do I know? And in my opinion, the only way to know really is to draw your blood, or some other form of hormone testing. But blood testing is the most simple and the cheapest, and it's very accurate. And I would just go with that. And I can't wait to hear how that turns out. So when you get this information, send us a message back and let me know. We always want to hear the other side of that story.
I will do that. Thank you very much.
Well, thank you for your question, and I can't wait to hear what happens.
Yes, I will let you know. Thank you.
Wonderful. Okay, we have our second question today about estradiol patches, and we have Mindy on the phone. Hi, Mindy.
Hi, Dr. Susan.
Where are you calling from today?
Calling from California, San Jose.
Oh, beautiful. I hope you're having wonderful weather like you always do there. Well, what question do you have for me today?
I'm on the estradiol patch, 0.0375, and progesterone 200 milligrams for 12 days a cycle. And every month I have a menstruation. So it makes sense to me that the progesterone is breaking down the uterine lining. So I'm a little confused because I don't hear women talking about having a period when they are menopausal and on HRT. So I was wondering if you can talk a little bit about that.
Oh, I am so glad you asked that question, because you do not have to have a period when you're postmenopausal. One of the best things about menopause is we don't have to have periods anymore. But the regimen that your doctor has you on is a rather old-fashioned one. So I'm just hazarding to guess that you have an older physician, because 30 or more years ago, that was the way that hormones were prescribed. It was thought that it was appropriate to have women continue to have periods even after menopause when they were on hormones. But since I've been in practice, and even longer, which has been 23 years and more, the standard has been to be on what we call continuous hormone replacement, which is getting estrogen and progesterone every single day. So estrogen, as you mentioned, and progesterone have different effects on the uterine lining. Estrogen causes the lining to grow, and progesterone causes it to shrink. So if we're getting both together every single day, the goal is that we're not going to have any bleeding at all because no lining grows. The way you're doing it, which was appropriate in the old days, that was sort of what was thought to be the best way, is similar to what happened when we were still young and fertile. We would have progesterone in our system just for half of the month. Like, for example, you're taking it for 12 days. 12 to 14 days was the standard. And you're getting progesterone in your system every day, just like after we ovulated when we were young. And then when you stop taking it, your progesterone level drops abruptly, and that signals your body to have a cycle, which is the same as happens in my 17-year-old girls and every young woman who's fertile. We ovulate, we produce progesterone, waiting to get pregnant. If we don't get pregnant, the progesterone drops, and we have a cycle. So it made sense that hormone replacement was originally designed to mimic nature in that way. But a long time ago, women said, wait a minute, I don't want to have periods anymore. And so we figured out a way to give progesterone every single day, and 200 milligrams is a very good dose. I take that myself every day. It helps with sleep, amongst other things. So a minimum of 100 milligrams a day, even 200 is totally fine. And you can take it every single night. Do take it at night because it makes you sleepy, so don't take it during the day. But take it at bedtime, along with your estrogen patch, and you will not have a period. Does that sound better?
That sounds much better.
Right. Maybe your doctor was a man. You don't even have to answer. But I don't think any woman would ever prescribe hormones in a way that makes you have a period when you're postmenopausal. That's just miserable. So it's absolutely safe to do that. It's much more convenient because you don't have to have a period. And I would suggest that you switch over to that regimen right after your next period. So when you've done your next cycle and had your period, go ahead and start taking them both together, or in other words, use your patch and take the progesterone every single day. And that way you're starting it when there's no lining in the uterus. And that's the best time to start it, so it reduces your risk of having any spotting or breakthrough bleeding. And the great majority of patients will never bleed again, which is wonderful. I haven't had a period in years, and it's fantastic.
Sounds wonderful to me.
And the other thing I wanted to ask you about was the dose of the patch that you're on. And we were just talking to the previous caller about estrogen patches and the fact that they come in several different doses. So 0.375 milligrams, I think, is what you said you're taking. That's a pretty low dose on the spectrum. Has it helped with all of your symptoms like hot flashes, night sweats, vaginal dryness? Do you have any remaining symptoms from your estrogen being too low? Because going up on the dose might be something to consider.
Yeah, I feel like I still have some brain fog.
Yeah.
And some anxiety.
Well, anxiety might be related to not taking progesterone every day. Certainly one of the benefits of progesterone is it helps with moods. Now, anxiety can occur absent of any type of hormone imbalance, of course, and so that's something we want to recognize. But I would see how you feel taking progesterone every day. And then has your doctor ever checked your estrogen levels to see if they're high enough?
Yes, actually she has.
Mm-hmm.
And I've asked her what level it should be, but she never gave me an answer. Actually, she would just change the subject or talk about something else. So I just took it upon myself to look up what my levels should be, and I think it should be around between 40 and 70 or something like that, right?
That's about right. Yeah, that's where most people feel good. So when we're talking about what your estrogen should be, one might say, well, what do you mean what it should be? Well, to me, it means where your symptoms are resolved and where you're also getting the benefits for your health as far as all the things we know, like osteoporosis prevention, Alzheimer's, heart disease, colon cancer. So below 40, as you mentioned, usually we're starting to have some of those symptoms. So I think that's a very good goal. Maybe just ask her what your level was and see if you're in that window. And if you're not, you could ask her to bump the patch dose up a little bit, because 0.05 is what most people are on. Not to say that's the same for everybody, because people absorb things differently. For example, I could have 10 patients on the 0.375 patch and draw their blood, and I get 10 different numbers because everybody's skin is different. The weather in California is different than Houston. Some people take a bath, some take a shower. That's what we were talking about earlier. There's a lot of variation in what we absorb. So the blood level is really interesting to assess whether you're on the best dose for you. So I would look at those numbers for sure and see if you need to adjust that. And then you also mentioned anxiety and a little bit of depression. Make sure she's looking at your thyroid as well. Now, there's lots of reasons to have mood disorders for sure, and they're not all hormonal related, of course. But make sure your thyroid's really been checked into, because brain fog and mood disorders are very common symptoms when our thyroid's not functioning optimally.
Okay.
So yes, no more periods for you. I'm excited about that. After next month, hopefully you'll be done with those. Yay! So please let me know how that goes. We'd love to hear the other side of that story. But for our listeners who are doing progesterone in a cyclic fashion and still having a period when they're postmenopausal, you don't have to do that. Take your progesterone every single day and you won't have a period. Life is much easier. It's safe. You'll sleep better. Your moods will be better. That's what I do myself. And I'm so glad you asked this question, because there are probably thousands of women listening who are taking progesterone just the way you're describing and putting it with having a period every month. And who wants that?
Oh. Well, thank you so much for bringing this subject to light to so many women in the same situation, Dr. Susan.
Well, it was my pleasure. And thank you for that question. And I cannot wait to hear when you circle back and tell us how you do when you change the way you're taking your hormones.
I will. Thank you so much.
So estrogen patches, lots of pros and cons. And like I said, I use them myself. So it's a great way to get estrogen in your system. But the dosing can be something that needs to be looked at. So if you have questions about that or anything else, you can submit them to drsusan.com/ask. And if you enjoyed this episode, please don't forget to subscribe, share it with your friends. Any comments are appreciated. And if you have other questions for me, you know how to reach me. I can't wait to see you next week.